Welcome to The Explainer. One of the biggest challenges in neuroanatomy is figuring out where a stroke happened, just by looking at the patient. Today, we're going to build a mental map to do just that, turning a really complex puzzle into a clear diagnostic tool.
All right, let's jump right in with a classic scenario. Imagine this. A patient understands you perfectly. They know exactly what they want to say, but the words just won't come out. So, where's the problem? Answering this is going to help us put the very first pin on our brain map.
Okay, so first things first, we've got to lay out the map, and we'll start with the two most important language centers in the brain. Now, for most people, we're talking around 95% of right-handers and even 70% of left-handers. These live in the left hemisphere. That's why we call it the dominant hemisphere for language. And boom, there's the answer to our little puzzle, Broca's area. It's sitting right there in the frontal lobe, and it acts as the brain's engine for producing speech. If this area is damaged, you get what's called Broca's aphasia, and it's a motor problem. The patient isn't confused at all. They literally just can't get their mouth and tongue to form the words they're thinking. Okay, this is where it gets really interesting from a clinical standpoint. Broca's area is tucked right behind a spot on your temple called the pterion. You can see on the side, it's this H-shaped spot where 4 different skull bones meet. And because of that, it's actually the weakest point of the skull. A direct hit there can fracture the bone, tear the middle meningeal artery that's running just underneath, and bam, you get a brain bleed that starts pressing on Broca's area. This, folks, is a full-blown neurosurgical emergency. All right, so if we move a little bit back from Broca's, we find its partner in crime, Wernicke's area. This spot is all about understanding language. And here's a super important connection you've got to remember for later. Both of these vital speech centers are fed by the exact same blood vessel. That's the middle cerebral artery, or MCA. Seriously, burn that name into your brain. So you might be asking, how does knowing all this help with strokes? Well, to get that, you have to know which artery supplies which part of the brain. And trust me, there's a simple and kind of weird analogy that makes this a piece of cake to remember. Okay, I want you to picture the brain as if you're looking down on it from the top. Now imagine a little person, a stick figure, hanging upside down with their knees hooked over that big dividing line right down the middle. Got it? This one single image is going to be the key to telling apart the 2 major types of strokes we're about to cover. So look at our hanging man. His legs are dangling down the middle, right? They're covering that inner or medial surface of the brain. Well, that whole territory is supplied by the anterior cerebral artery, the ACA. Meanwhile, his face and arms, they're draped over the outside, the lateral surface. And that is the territory of the middle cerebral artery, the MCA. See how that works? And this is where it all clicks. The symptoms literally tell you which artery is in trouble. If your patient has weakness in the leg on the opposite side of their body, and maybe they're having trouble with bladder control, you should immediately be thinking ACA stroke. But if the weakness is in the face and the arm on the opposite side, especially if they're struggling to speak, that is a classic MCA stroke. The anatomy perfectly predicts what you'll see in the clinic. Okay, let's zoom in a bit. All this info, everything we see, hear, and feel, plus all the commands to move, it all has to get routed to the right spot on the brain's surface, the cortex, and that job belongs to the brain's grand central station, the thalamus. Look, if you really want to understand how the brain is wired, you have to know these thalamic connections. Seriously, think of it like an old-school telephone switchboard. An input comes in, and the operator, the thalamus, plugs it into the right output on the cortex. This next part is pure, high-yield exam gold. Okay, this table right here, this is the switchboard in action. Let's just walk through the heavy hitters, right? Look at that first row. VA and VL. They get info about movement and send it to the motor cortex. Makes sense. Next, you've got VPL and VPM. These guys handle sensation. VPL is for the body, VPM is for the face. Simple enough. But here are 2 you absolutely cannot forget. The LGB, the lateral geniculate body. L is for light. It's all about vision. And the MGB, the medial geniculate body. M is for music. It handles hearing. These connections, right here, are the literal bedrock of how we experience the world. All right, time to put all the pieces together. We've got our brain map, we've got our wiring diagram. Now we can really act like clinical detectives and start decoding what's going on in the major stroke syndromes. Here's a super powerful rule of thumb for diagnosis. If a patient's symptoms are all on one side of the body, a weak arm and leg on the left side, period, what we call purely contralateral deficits, the problem is almost certainly high up in the cortex. But If you see crossed signs, like, say, a facial droop on the right side but weakness in the left arm and leg, that mismatch points you straight to a problem much lower down in the brainstem. So, after all that, here it is, your quick and dirty clinical cheat sheet. You ready? Weakness in the opposite leg, plus maybe some incontinence? Think ACA. Weakness in the opposite face and arm, especially with trouble speaking, that is screaming MCA. And what if it's purely visual problems, like they've lost one whole side of their vision? That points to the third big player, the posterior cerebral artery, the PCA, which supplies the visual cortex way at the back of the brain.
And that brings us to our final question. A question that, honestly, you can now answer with total confidence. By understanding the brain's functional map and how it gets its blood supply, you've just gained an incredibly powerful tool. You can now take a jumble of symptoms and actually pinpoint the problem on the map of the brain. You've learned to read the map,